Yeah, I'm Professor Dr. Ossei Sampene, former head of Department of Pathology. Currently the head of Pathology Forensic Units at KNUST and Confirmed Teaching Hospital. Thank you so much, young girls, for the initiative and the effort you guys are making sure that these children, especially these poor kids who are afflicted with this type of disease called pediatric cancers. And in fact, we know that disease is a combination of genes and environment, of which pediatric cancer is no exception. But of course, if the definition that you just given when talking about disease, reviewing the literature, one can also add some few things that can also be a factor when a disease affects somebody. One of which I believe should be poverty, ignorance, and to some larger extent, religion. In fact, religion, I'm not talking about the conventional religion that we are always, we always know to be. But I'm talking about religion as in one being accepting the fact that he's poor and getting the belief that he's poor. And that leads to ignorance, and that leads to probably a whole damage to himself or herself, and to some larger extent, a child. So a lot of people don't believe that cancers or cancer can affect a child. But here is the case, cancer or cancers can affect children, especially these Wilms tumor, which of course can be cured. But out of ignorance, they seem to keep some of these children in their homes with the belief that whatever the child is actually experiencing might be something that might be afflicted on him by some supernatural powers. But all said and done, these diseases, as you have already taken it upon yourself, to be able to educate the masses, including myself and some of our mothers and parents who, for some reason, do not know that some of these diseases can be cured. It is that of importance that you students, medical students for that matter, have taken it upon yourself to do the education. And I must say that you have done well, and I commend you for doing that. But what it is that these children need our help. In our own whichever small way, whether we give education or we contribute financially to make sure that these children also enjoy the best of health, we have to do and make sure that we achieve the goal that you have set for yourself, including whoever is interested. So once again, I will thank you guys for doing the right thing, making sure that these children get the best of health care, the best of life, and that we tell the parents, we tell the whole world that yes, this disease, yes, they are cancers as we call them, yet they are curable. And therefore, anytime a child is afflicted by this, they should come freely to the hospitals and then be screened and then eventually get the needed cure that will make them also comfortable and a better life. Thank you.